Hey, have you had enough of the bad news? Me too. Well, wait a minute. We're going to talk about hospice. You're not going to believe what we're going to tell you. Come on back and join the Woman to Woman show. We'll be right back.
My humanity found God's perfection is self, and where love always abounds, then I'll reach out for your help, saying I fall down, saying I fall down, saying I fall down, saying I fall down. In the stillness of my soul, where nobody knows, containing all my fears, containing all my tears.
Hi, I'm Luann. Welcome to the Woman show. And I have a great guest with me today. This is Linda McIntyre, RN, and she is the hospice queen. She is going to tell us, didn't know you were going to be introduced like that,
No,
did you?
I didn't.
She has been involved in the ministry, and I like to call it a ministry because I think that's what you do.
It is.
For 18 years, just about. And she just informed me something I didn't know. This is National Hospice Month, the month of November, and you know, there's lots of fun things going on and there's lots to talk about hospice, but I just kind of want you to start off, and for somebody that doesn't know what it is, they've heard of it maybe, but they really don't know what it's all about, can you kind of describe what is hospice exactly, and what's going on when you are involved in hospice?
The hospice program was established to help care for patients who have a diagnosis that will most probably bring the end of their life. So it's referred to as end-of-life care.
Okay.
The physician and patient and family have done everything that can be done medically
To cure.
to cure. And we like to say that they've had all of the aggressive treatment for cure, and now they're going to have aggressive treatment for comfort.
I love that.
Hospice comes into the program to assist them to spend the final days of their lives the way they choose.
Okay.
We are well known for our excellence in pain control.
Yep.
You have RNs, you have home health aides that will come in and help bathe or do personal care.
Right.
You have social workers who are available for family counseling, community services, you know, just an extra ear.
Yeah.
We have 2 medical directors in our program that help us with medical decisions and medications and planning a course of treatment. We have all kinds of therapies. We have physical therapy, occupational therapy, music therapy, art therapy, massage therapy.
Yeah, I couldn't believe that one.
Yeah.
That is so cool.
Yes,
I
it
have
is.
to say
It is.
that's really over and above what anybody would ever have heard of, I think.
I don't think people expect it.
No.
I think they're very surprised at what the hospice program can bring into their lives. And that the focus is not the dying.
Okay.
Our focus is the living. You know, we are helping them take the final days of their life and make them important, memorable. We don't...
And pain-free.
And pain-free.
And I think, can you talk about how the fear of pain, when somebody is in that situation and they've gotten a diagnosis of, you know, this illness, it's going to take their life, and they go, not for me, not me, you know, that's it. I don't want to be in, you know, either unbearable pain or so zonked out, I'm not conscious. Can you talk about how that's not true?
We hear that a lot when we do our admission process, and the first thing people will say to us, the patients will say to us, is, I don't want to be in pain, and I don't want my children to see me out of control.
Okay.
But then the children are saying to us, we don't want her to be in pain, but we don't want her to be zonked.
Yeah.
So there's a fine line between sedation and being pain-free. Luckily, hospice nurses are really, really good at finding that line.
You guys are.
Well, you know, we've dedicated ourselves to a program of medicine, and hospice is a program of medicine. And so we have to be educated. I can tell you that at Adventist, the medical directors are very sure we're educated. They're very, very good at what they do.
Yeah.
And so we offer them that assurance. They will not be in pain. That will not be something that we're going to not treat. And we have a million potions that we can use.
I love it.
That will, and sometimes we have to kind of mix them to find what's right for that person. But each person is an individual, and so we come up with a plan that works for them.
Well, I know, you know, my own mom was a recipient of hospice care, or I never would have heard of it. And I remember, just like, you know, you're doing over there, the nurses constantly were tuned in to asking her, how's your pain level? Do you have any discomfort? Can we do more?
Yeah.
Can we do more for you? And I was sharing with you the fun thing about hospice nurses, and I know this is widespread. They don't come in, do their job, check blood pressure, I'm out the door. They sat down and had tea with my mother and talked about, you know, the furnace that didn't work, or, you know, their cat, or whatever. Like, they were family, and they treated her. I want you to talk about what's your caseload right now, and, you know, let people see a contrast.
On an average day, I work a 10-hour day, and I'll see 4 or 5 patients.
I don't believe it.
So, and we are free agents as far as how we spend our time, because some of our patients will require more of me one day and less the next. And so we go in to that home, we're not clock watchers.
No.
So we can offer them the care and support that they need at that time, or their family needs at that time. It's really an incredible thing to be allowed to do. So, and one of the things that happens is we make scheduled visits, so which means that our hospice program goes once or twice a week. Most of us go twice a week on a regular basis.
Okay.
So they know we're coming on Tuesday and Friday, or Monday and Thursday. Then we're also available any other time.
And I knew that to be, Mother had their cell phone numbers, and she called. You know, if she had a question about anything, they said, you call. If you have a question, or something changes, and they meant it.
Yes, they do.
You know, it wasn't, they were just being nice.
The only question that we don't like is the one that's not asked.
Oh, I love that.
It's very important.
I love
because
that.
If it's a concern or if it's a question, it needs to be answered. So we tell them.
Yeah, and you don't want someone worrying.
Pick up that phone and you call us.
Yeah.
And if you don't get your nurse, that, you know, you'll get a nurse that can get the answer.
Well,
give you the answer.
I want you to talk about these programs and who covers, because people think, oh, I bet I couldn't afford that. Sounds great, but I probably can't come. Talk about that.
One of the nicest things we get to do during the admission process, if a patient is 65 or older, or is already a recipient of Medicare, we get to tell them that there is no cost to them for any of
Zero
for any of the services the program offers.
People need to know that.
And what that includes is the medications that are related to their diagnosis.
Okay.
So if they're a cardiac patient, we pay for all their heart meds.
Oh my heavens.
Their pain medications, you know, anything that would be offered to them for comfort or for that particular process of disease is covered by the hospice program.
Yeah.
All of the therapies, all of the medical equipment, if they need a hospital bed, if they need oxygen, if they need a wheelchair.
Yeah, my mother had oxygen. It's all true. I'm telling you, I live this. That she's right.
You know,
it's true.
The therapists that come out, the home health aide that comes out.
It's all covered.
It's all part of the program.
Okay, if you're under 65.
If you're under 65, Oregon Health Plan here, we're blessed to have that. It covers the hospice program.
I'm glad to know that. They need to.
They do need to, and they do. And
I'm so glad to know that.
They also have, many insurances will have a hospice clause.
I know.
Some of them have a limit. You know, they'll have a dollar limit.
Okay.
Or they'll have a time frame limit.
Okay.
And